Thank you for choosing Upstate University Hospital Community Campus for your swift knee surgery. You and your doctor have discussed the procedure and decided to have a swift knee replacement. The swift knee procedure is a total knee replacement that typically allows patients to be discharged on the same day as their surgery or the following day. The key to the swift knee procedure is rehabilitation preparation and planning, or what we like to call prehab. You will be scheduled for 1 to 3 outpatient physical therapy sessions before your surgery. You and your therapist will review exercises, the devices you will use after surgery, your post-surgery therapy plan, and discuss how to prepare your home to make your rehab and recovery easier. At this time, we will also schedule an outpatient therapy appointment for after your surgery to ensure your recovery stays on track. As part of your prehab, you will receive a booklet that explains your surgery and what to expect. A nurse will contact you before your surgery to work with you to create a safe care plan. You will be required to attend a swift knee joint class. This class provides an overview of what to expect and offers you one-on-one time with your orthopedic care team. Before your surgery, you will also be scheduled for a pre-testing visit. During this appointment, we will schedule the date and time of your surgery, tell you when to arrive at the hospital, and provide you specific instructions regarding your diet and your medications on the morning of your surgery. On your surgery day, please wear pull-on pants with secure, comfortable walking shoes. It is especially important that all jewelry, including wedding rings, be left at home or with a family member, along with all electronic devices. When you arrive at the hospital, please register at the patient access area and then follow the signs to the surgery center admitting area. At the surgery center, your surgeon, anesthesia team, surgery center nurse, and operating room nurse will be available to talk with you and answer any questions. Your anesthesiologist will discuss options for anesthesia as well as post-surgery medications. While you are in surgery, family members are welcome to stay in the surgery center waiting area. Please choose and identify one person as your main contact to receive updates on your progress. Following surgery, you will be taken to the recovery area. You may be experiencing pain and discomfort. However, our top priority will be to manage your pain to the best of our ability. While here, we'll take an X-ray of your knee, and a physical therapist will begin rehab. For your safety, please remember to never leave your bed unassisted and to always ask a staff member to help with any needs. The therapist will work with you to improve mobility while providing tips on managing your self-care at home. Before being discharged, you will be given a full evaluation to ensure that you are safe to return home. We'll make sure you can successfully navigate stairs, perform your exercises safely, and manage everyday activities such as bathing and dressing. Although our goal with the swift knee procedure is to have patients return home on the same day as their surgery, every patient is different, and it's possible that you may require an additional day or two at the hospital to facilitate your recovery. Once you return home, we will ask you to return 2 days later for your follow-up therapy visit to ensure your recovery remains on track. Thank you for choosing Upstate University Hospital Community Campus for your swift knee surgery. Our goal is to provide a great experience with a successful outcome.